Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I have a very special guest. She's a friend, a patient, and a certified respiratory therapist. You say respiratory therapist or technician?
Respiratory care practitioner.
Okay. Her name is Carolyn Graham, and she's a dear friend, and we've kind of bonded because over this CPAP stuff, which we're going to go over, but she's had a lot of experience in not only sleep apnea, but respiratory care in the hospital and outside the hospital.
Yes.
Tell me a little bit about how you got into this and what you've done.
Okay, in '89, I decided to go back to school, and I went to Mountain Empire College and got a respiratory degree. I went into the hospital right out of that for 5 years because I think it's important for any respiratory therapist to have hospital experience prior to getting into home care.
In the units and all the,
yes.
Yeah, certainly. With
So
respiratory, ventilators and all that stuff.
Exactly. Okay. So in '95, I went into home care, and I went around visiting patients, checking on their compliance, see if there was cleaning everything properly, and I just love that, teaching people of how to take care of themselves.
Well, you're a great teacher, and that's why when I was talking to you one day in my office, I decided, hey, we need to do a podcast.
Yes.
Because in the meantime, I had been diagnosed with sleep apnea.
Right.
And you have it as well.
I have.
And, you know, I've studied a ton of my patients so far, and in fact, most of them have sleep apnea. Now, tell me why it's so important that you know that you have sleep apnea, because a lot of bad things happen if you don't know.
Yes, a lot of bad things happen. You can have heart damage and heart failure due to not having the CPAP or correcting the issue. You can have atrial fib, you know,
See that a lot.
arrhythmias.
Yeah.
Which I did have arrhythmias before I went on this. So, and then sudden cardiac death. I mean, you know, that is alarming. You know?
I think that's what killed Reggie White, according to the reports, a famous football player.
Yes.
But yeah, one of my best friends had AFib, and when he got on a CPAP machine, it went away.
Yes.
And
that's
that was
wonderful, isn't it?
that was just a light bulb that turned on for me, because we're seeing a lot of folks our age coming down with AFib, which is a dangerous rhythm, can cause strokes.
Yes.
So you got to know about this sleep apnea stuff. If you're an adult, you have to know if you have this or not to lead a quality life. There's no doubt in my mind. I mean, I used to think personally that sleep apnea was only for obese people or people with a thick neck, and that was wrong.
Yes.
How many adults do you think have sleep apnea?
I would think that 80% of the patient population has some sort of CPAP problems. 80%.
80% of adults
Yes.
probably have some form, whether it be mild or severe.
Yes.
I was shocked when I got my study that I had 34 episodes of hypopnea per hour. I mean, that's severe.
That is, yes.
And now I have less than one half,
That's
maybe.
right. Yeah,
but
that's great.
the reason I really wanted to get you in here is because of the CPAP machines.
Right.
You know, the obvious treatment, the most common treatment, is CPAP.
Yes.
And the thing about CPAP, when you first go on it, you're going to hate it. I mean, it is not fun to get used to a CPAP machine. A lot of it's because you don't know what you're doing.
Right.
And, you know, you have something over your nose or maybe mouth or maybe both. There's a lot of different ways you can do this. And I really felt like I didn't get adequate training. Maybe some of it was my own fault, but I really felt like I didn't get trained enough about the nuances, the different, you know, things I could use with it, which we'll go over a little bit, how to clean it, how to take care of it. And there's a lot of little things that you need to know. So you're in my office one day for something, and we started talking about this, and I said, I want you to help me.
Yes.
You know, figure this out for me, which you've done.
Yes.
And it may lead into her actually doing her own little gig, maybe once a week or once a month. In my office, I just give you a room and you can just educate patients on how to do this, because CPAPs are something that you love because it makes you feel way better. If you look at your sleep patterns on your OURA ring, I mean, there's no comparison. And you're just going to be more energetic. You'll love the results, but you'll hate the machine, especially at first, because it's onerous. It's hard to get used to. There's like a 50% compliance rate over 1 year. Correct. And that's why you're getting these other things they're looking at, like the Inspire, where you have to have a surgery and implant something in your chest with wires up through your neck. I'm not against it. I've got a few patients that like theirs, but there's also about a 50% success rate with those. So personally, I don't want to go through that.
No, and I don't either.
And things will evolve. That'll probably improve in the future, so we'll always keep our eye out. But let's focus on this CPAP machine a little bit. Now, first of all, a couple points. You have to keep this thing clean. Yes. And that's something most people probably are not doing. The typical machine looks like this. It's a tiny machine you put by your bedside table, and it has a tube on it, and it's attached to a hose, and you put it on your face. Now, I prefer the nasal one. I was a mouth breather, and really mouth breathing, that's terrible for you. If you look at some of my podcasts on breathing, or go to Nelson's book on breath, you'll find that nasal breathing is very good for you. It's terrible to be a mouth breather. And if you wake up with a dry mouth, you're a mouth breather. Yes. And it's just horrible for you. But anyway, I chose the nasal, and I'm going to probably look at this again based on what you've told me. But this thing just fits over your face. I mean, it looks like you're an alien or something, but if you can get used to it, you'll actually find that it's really comforting to you. And this thing has allowed me to sleep on my back for the first time in my life, which I think is the best way to sleep. Instead, I used to sleep on my stomach, which is a horrible thing to do. Oh, yes. And it allows me to get on my side a little bit. So let's go over this thing a little bit. Again, there's different types of masks. Yes. Here's the one you wear. You have sleep apnea too.
I do.
And if most of us will admit it, most of us do. So yours is a combination of a nasal and a mouth. It's called an F40.
F40.
I'm going to try one of these out. I did not do well with the nasal pillows personally. They irritated the inside of my nose. Yeah. Some people love them, but there's a lot of different options.
There sure is.
The hose comes out the front here. On mine, it's on the top. The fit's real important. These machines can give you feedback. But she's taught me a lot already. Again, you have to use distilled water. You cannot use tap water on your machine. You need some kind of moisture humidifier on these things. Yes. Believe me. And it's important that you clean it with distilled water. Correct. And she will give you the frequency when you need to clean them. This thing also comes with a filter in your machine, which I had never changed until I saw her.
Yeah. It's in the back right here.
In the back of your machine. You need to change that once a month. I'd never changed mine, and it's filthy. And she also set me up and told me, based on your work in the hospital, that you need one of these filters that looks like this, that fits, which she just put one on for me, between the hose and the mask. Those things get dirty too. So you don't want to be breathing in moldy, pollen, dust, air. You have to keep these things really clean. Yes. Once you get in the routine, it's not hard, but it's very important. And nobody ever told me about this. Nobody told me how to change that. Right. Nobody told me there was should be an SD card in here to kind of analyze where you're at, because people need different pressures. Yes. And all this, so it gets it's kind of complex, but what I'm trying to do for my patients is make it simple. And
that's they can feel better when they come. I mean, to your office and say, hey, I feel good. Don't have brain fog today,
I know. And I want them to be able to use this thing and use it right. Tell me a little bit, through your experience with working with patients, what's commonly mistakes do they do? Not cleaning it, not getting the right fit?
Yeah, and not calling in when they're having trouble with their machine or their pressures. You know, call in and let somebody know, hey, this is not working for me. I'm still snoring. Number one clue, still snoring with the machine on. And they need to call in and get some help, you know? And but I find that patients are just let loose, most of them, and they don't even use it. They put it in the closet.
That's right. That's right. I admit it may have been my own fault, but I didn't get a lot of good training on this whatsoever. You know, I made the diagnosis myself through a home sleep test.
Right.
You know, what I'm trying to do in my practice is make things simple for people.
Yes.
I mean, obviously a sleep lab is the gold standard, but there's a few drawbacks to that, and I don't think your average patient really needs that unless you're got some weird problem going on, like central sleep apnea, which we'll talk about. But really, I mean, they're very expensive. I mean, $5,000 or $6,000.
Yes.
Insurance probably help out, but there's like a 6-month waiting list, and you have to go in a strange place with stuff all over you with somebody watching you.
Yes.
I mean, I don't want to do that personally. I just don't want to do it.
Right.
And I think a lot of people are like me. They don't want to do that.
And they won't do it, like you said.
When I go spend a night somewhere, I want it to be in a nice hotel and you know, at the beach or something.
Yes.
I don't want it to be in a dark building with people looking at me.
Right.
So I'd rather if I can get a good home sleep test, which is available, look at my podcast on that, through a thumb ring, and they can tell me really what I need to know.
Right.
And then get set up with this. But the problem to me has been getting it right on my CPAP machine.
Exactly.
So give me some tips on how you would approach a patient that newly diagnosed sleep apnea. They have this machine they've been given, and usually let loose unless you really are complicit with follow-up, which most people, in my opinion, aren't. Well, what advice would you give them?
I start out basically by telling them what CPAP means.
Okay.
They don't even know what that means.
I have no clue.
So it's continuous positive airway pressure.
Yeah.
To help keep your airway open to where, you know, the little uvula back there and all that just relaxes and you can't get air through and you start snoring. Yeah. But I go over the machine with them. I take everything off of it and I go over how to clean the tubing.
Okay.
Which I would recommend once a week on this.
Okay.
You can even take it in the shower with you too. Just cover that, because this one has a heated thing. Now you can use a regular hose on here too. You don't have to use the heated. We have the heated one.
Okay. Yeah.
Okay.
Yeah.
Which I prefer. It's just pretty good. But you do want to clean the inside. Run some vinegar and water down, so it's really good.
She taught me that trick, vinegar and water. Nobody ever told me that.
I mean, and then of course you have the filter that you went over in the back.
Okay.
And then what I normally do is have them to put it on, and they're going to tell me. I'm going to ask them, have you been sleepy lately? You know, are you falling asleep at the red light? You know, there's a questionnaire. It used to be called the Berlin Questionnaire. I don't know. They might have changed the name by now. But when I go to the doctor, I have to fill that out. You know.
Yeah.
So I have them to put it on, and you can order an overnight sometimes too, just to see what they're doing. You know, see what their sats are running.
Yeah. Yeah.
Because your blood pressure is going to go up if you don't wear this machine.
That's exactly
and
right.
your oxygen level is going to drop.
You know, my OURA ring, of course, tells me my sats.
That's wonderful.
So this really thing clued me in that I had sleep apnea for number one. I'm a huge believer. I've used one of these things for 5 years.
Yes.
You should get an OURA ring.
Yes.
It tells you how much REM you're getting, how much deep sleep. You yourself have REM sleep disorder.
I do have REM sleep disorder.
Tell me about that a little bit.
That is where I don't really fully go to sleep. I'm laying in bed, and I don't paralyze like the normal person does. You know, because you have a paralysis like that, you know, when you're in that deep sleep.
When you kind of jerk, you're getting into that paralysis.
So
sleep
I can get up, hit into the wall before. They want me to take all the guns and the knives out of the bedroom, which I don't have that in the bedroom anyway. But I don't sleep well, if that makes sense, you know, because I have that REM sleep. So I'm on medication for that. Plus they put me on the CPAP, and it's a world of difference. I look forward to putting that on at night.
Yeah, me too. I actually look forward to it. It's crazy. I never would have said that, but because I know I'm going to sleep way better. Tell me a little bit about central versus obstructive sleep apnea, because this new thumb ring that we're using will tell you that. I have a few patients that have some central, mostly obstructive, but some episodes of central.
Yes.
There's a different kind of machine for that, right?
Yeah, you can get a backup rate. If you have central apnea,
which means your brain's not telling you to breathe, right?
Exactly.
Okay.
So therefore, you're waking up.
Yeah.
And some people wake up like 200 times a minute. You know, I mean, it's just wild. So if you have the combination of OSA and central, then you really are having some problems.
Yeah, yeah.
So therefore, it's very important that you use your machine.
Now, that type of machine you're talking about, what's that called?
The bi-level.
The bi-level machine.
Yes, if you fail on a CPAP, you need a bi-level.
It's kind of like BiPAP.
Exactly, BiPAP, yeah.
Okay, tell me what that means.
That means that you have two pressures.
Okay.
See, CPAP is one pressure.
Yeah.
Most patients don't know that.
Okay.
And then you have two pressures, one coming in, one going out at a lower pressure to help support that breath when you breathe out.
So help you breathe out.
Yeah.
Okay.
So you're not suffocating. You're not feeling like you can't breathe in and out. You know, you get that flow coming out, and you set a rate.
Okay.
So if you don't breathe, say 12 to 14 times a minute, the machine's going to give it to you. So if your brain's signaling that, it's not going to signal you to wake up because you're getting that pressure.
I know when a lot of people were hospitalized with COVID, they had to, instead of being on a ventilator, a lot of times they got by with being on BiPAP. And that was a great thing for COVID when you got into desatting and had hypopnea and all that. So there is an option. You told me there's also an option for people that have COPD or chronic respiratory diseases to put oxygen through this.
Yes, you can. You just use an adapter, hook it to the concentrator, and turn on your machine, and then turn on the concentrator so your air, is going through.
Okay.
And then I believe that they need to be tested for that after you've had that on, and to make sure that you're maintaining an oxygen above, 95%. I like a good. Of course, some people's going to be 90. You know that, and I do too.
Yeah.
Which is okay for them.
Yeah.
But people just do not realize, or patients do not realize, how important this is. This is very important.
I agree 100%. And again, this OURA ring tells me what my O2 sats are during the night, how restless I was.
Oh, it's wonderful.
How many episodes I had of my O2 dropping.
Oh my goodness.
And what the average is. This thing's amazing.
We all need one of those.
We all need an OURA ring. But so there's a lot of different options to these things. There's some maintenance to it. The problem I have with this whole deal is it's so hard to get into a sleep lab, talk to a sleep doctor. Really what I found, because a couple of years ago I thought, well, I'm just going to leave it all up to them. I'll refer them. 6 months later, they may or may not keep their appointment. Then they have to go into the sleep lab for a couple of nights. They just don't want to do it.
No.
Then they start asking the price of it. So that's when I morphed into this thing where I'm going to find out, especially when I found out I had it.
Right.
You get real interested when you have a condition.
Yes, you do.
And treating it.
I think that's why I'm so interested in this too, because I have that.
Of course. I have 2 diabetic kids. I love treating diabetes because when it hits home, you're way more likely to be more educated and tell patients the practical stuff about diabetes or this.
Yes.
But so I realized pretty quickly after looking at the studies myself through these home sleep studies, which are inexpensive. If you pay cash for them, they're real cheap, but your insurance will pay for these things.
Yes.
And then got educated on this thing, and you don't really have to go through a sleep doctor or a lab. And really the reason I wanted to talk to you too on my podcast, because I'm thinking about, and I want some feedback from the audience as to how interested they may be to having you work with them in my office just on your own. Right. It should be your gig.
So like have a clinic.
Once a week, once a month, just for people that are not getting used to these things or don't know how to do it, to come in and spend an hour with you.
Yes.
And you looking at these things. So they give you feedback on these machines.
Yes.
And to get them really going with this. So that's a possibility. I don't know. You know, we may work something out to where we end up doing that. But it's so important that you realize that you may have this. There's a way to feel a ton better and prevent those cardiac arrhythmias, hypertension, heart attacks, sudden death,
stroke.
I mean, your respiration counts. It's really important, especially during your sleep.
And the older we get, right?
The older we get, most of us get some form of this.
I agree.
I mean, I think that's why I have it. I'm 70 years old, almost. Be there in a couple months. But in any event, Carolyn Graham, certified respiratory therapist, technician, educator. Thank you so much for doing this. I know we've just barely touched on this stuff, but my hope is that you can help some of my patients.
Yeah, I would enjoy that.
Spend some time with them.
People become compliant and feel better.
Yeah, because it does no good if you're not using it. If you're throwing it off in the middle of the night and you're not using it, it doesn't do any good. You've gone through all that for nothing.
For nothing. I mean, you paid all that money out and you feel lousy. You just, your brain is not there, you know. It's
so important for heart health, brain health, everything. So, Carolyn Graham, thank you so much. I hope you've gotten a lot out of this. There's a lot to it. So, if you have any questions, please call us at our office, Performance Medicine, or go onto our website. I hope this helps. We'll see you guys next week. Okay, this will be our demo with Carolyn Graham, certified respiratory therapist. There's a lot of different masks and fittings you can do. Now here's the one I'm using, and again, you want to keep your mouth, when you use a nasal only mask, you want to keep your mouth closed. You probably will anyway, because when you open your mouth, the air comes out. Some people, if they just drop their mouth open, they'll use a chin strap, or some may even use mouth tape. My brother uses that, and a lot of people I know use mouth tape. I'm not against it, but I know for respiratory therapists, it's not your first choice. They just say, don't do it. But some people do it.
But if it works, and the only way you'll use it,
I agree. But this is the one I'm currently using, and again, it's just, you just fit it on there, and my hose fits behind there, and I just strap it. It snaps together pretty easly. And
you're going to have that extra filter up there too,
And the extra filter's up there. So that's the one I'm using currently. But
exhalation comes out right here.
Exhalation.
So you can feel that if you need to while you're wearing it.
It's real easy. My nose is kind of narrow, so I use a Breathe Right strip every night anyway. And that really helps open up my nose a little bit. But let me try yours.
Yes.
Now, yours is different. It's called an F40.
F40.
Which I'm going to just try out. And it's a little different because it covers your mouth. Kind of keeps your mouth closed, but if you inadvertently open it, you're cool. Yeah. If I open it with this, air gushes out. I think it wakes me up a little bit.
Right.
So this one fits over.
The holes have to go
right like that.
Now, let me see. It's got to go under your nose. Now, there you go. That's correct.
There you go.
There you go. Let me turn it. Well, mine ain't plugged up, but yeah.
And it's got one strap.
Well, it's got two, but I only unhook one at a time.
That's
so that I can just come in and put it on, and you've got the strap.
So I'm actually breathing through my nose with this one.
It's kind of loose on. Yeah,
I just put it. So I'm breathing through my nose, but yet my mouth is covered as well.
Yeah.
I like that. I'm going to try this one.
Yeah.
The air pillows for me irritated the inside of my nose.
Yes, did me too. Yeah.
But this is I'm going to order one of these F40s. The other thing too, one thing I will say, when I get up to go to the bathroom early in the morning, you know, I'm a man with a prostate. You know, we all get up early, some more than once. But I just take my thing off, and I never, you know, it's usually 5 in the morning. I'm not going to put it back on.
Exactly.
Now you have an easy on and off attachment that I don't have that I need to get. Show me that.
This little attachment here, when I've got it on and I want to go to the restroom or whatever, get a drink or whatever, just unsnap it. I lay it over here under my pillow.
Okay.
And I just go, you know.
Okay.
You've got a hole there. I mean, you breathe through that.
It just snaps right into place.
It snaps into place.
Yeah, yeah. That's way easier.
Yes.
I think that'd be a great thing, because really, when I look at my OURA ring, and usually after I throw it off and don't put it back on, there are some, I have 2 more hours of sleep.
Yes.
And it's not good sleep.
No, because then you're probably not getting oxygen,
Yep.
where you need it.
Yep.
Yeah. But you want to wash this cushion. Insurance will pay for these cushions.
You change them
3
out
a
how
month.
often?
I would change it out monthly.
Monthly on those cushions, because they
Yes.
get a lot of oils and
Well,
things
they
on
just
them.
break down.
Now, do you wash yours every night with like a baby wipe
No,
or anything?
I use CPAP mask wipes.
Oh,
You can
okay.
buy those.
Oh,
They
okay.
come in like a little container.
Okay.
Pull it out.
And every night wipe it off before you put it on?
Yes, and every
Okay.
morning I wipe it off.
Interesting.
know,
And
yeah.
you clean this little thing too.
Yes, I clean the humidifier.
With the distilled water in it every
Yes.
morning when you get out.
Yes.
And once a week you just soak your whole machine, including your tube, in a little
Yes.
white vinegar for half an hour.
Water and vinegar.
Okay, water
Yeah.
and
Say
vinegar.
a fourth a cup of vinegar and then maybe a cup of water.
Okay.
I let it
okay.
soak for 20, 30 minutes and then
Okay.
rinse it real well.
And you change your filters out routinely once a month.
Once a month.
Both this one, which is important, and this one that fits in your machine.
Yes.
So there's a lot of different ways to do this. I really hope you'll take the time to listen to this and maybe get an expert to go over this with you. It's going to take a little time. You can't just, here's your
Right.
machine, see you, and follow it up by phone. I like it in person
I
with
like
your
it.
machine.
And I like somebody interested in my health.
Yeah, exactly right.
Yeah, which you do,
And you are. And you're amazing, Carolyn. Thank you so much for this demo. We'll see you guys later.
Thank you.